Hi, I'm Dr. Mark Zala. You've been referred to me for treatment of your skin cancer, usually with a procedure called Mohs Micrographic surgery. There are many treatments available for skin cancers. If there are some which might be appropriate for your cancer, I will go over those with you. But Mohs Micrographic surgery has been shown to be the most effective treatment for most skin cancers, especially those at higher risk. While some may be treated with creams, or scraping, or routine cutting, or occasionally even radiation, Mohs surgery is the most careful way of checking the edge and the base around a cancer to be sure it's completely removed before we put it back together. This is a method of removal that goes step by step. So we remove what looks suspicious, check it under the microscope, go back and take more if we need, but hopefully this allows us to keep the wound as small as possible because we can check the edges so closely, and hopefully limit the scar and limit the risk for recurrence. While risks with Mohs surgery are very low, we want to go over those risks with you and be sure you have no questions. We have a consent form like this that the nurses will give you to read, and I'll go through it now. The most important thing, of course, other than being sure the cancer is gone, is that we minimize the scar. In some cases, we might let a wound heal on its own. In many cases, we sew those wounds back together after we check the edges. No matter whether we let it heal or we sew it together, these wounds mature under the surface for 6 months. So it's not going to be at its final appearance for about 6 months after your surgery. By that point, we'd like it to be blending in nicely. For any reason, if it's not, let us know. We'll see if some revision or touch-up were needed. Otherwise, risks are minor. There can be some mild tenderness the first 2 days after surgery, the day of surgery and the next. Almost always, Tylenol is sufficient for that. So we give you the first dose of Tylenol before you leave, and I suggest a dose every 8 hours while you're awake on the day of surgery and the next day. This way, you stay ahead of any aching and minimize the discomfort. Also, there's a very low risk for bleeding, but that risk is greatest today and tomorrow. So we do ask you to avoid lifting, exercise, exertion today and tomorrow. Usually you can get back to normal activities the second day after surgery. Also, there is some swelling from our anesthetic. Swelling often causes bruising that you can see the first week after surgery. That's normal and will go away on its own. Risk of infection is very low, about 2% for most of our surgeries. This would be suggested by redness, warmth, swelling, and pain. If you get concerned about infection at any point after your surgery, give us a call. Tissue loss is uncommon following Mohs surgery, but this would refer to a graft or a flap, which are 2 ways of sewing a wound back together that don't take entirely. That's very unlikely for most wounds on the head and neck. If a graft or a flap did not take, a scab would form. It's slower to heal, increases the risk of a scar, but we give it 6 months to mature and deal with the wound at that point. That's very unlikely. More likely than that is some numbness. All wounds can be numb for about 6 to 12 months, but most will get back to normal by that point. If there are certain particular nerves at risk in your location, I will review those with you when we look at the skin. The cure rate with Mohs procedure for a basal cell cancer is 98.5%. That's the most common of the cancers. For a squamous cell cancer in a healthy patient, the cure rate is 96.5%. So in both cases, very unlikely to come back. If you do get concerned about recurrence, give us a call. We do take some photographs before and after your surgery, and we will send those photos to your referring doctor or to your primary doctor so they know what's been done. What we do today is covered by insurance, aside from copays or deductibles. Occasionally we have visitors, medical students, residents, nurses, PAs, observing with us. If so, I'll introduce you to them, but they are usually just observing. We are not doing any active research at this point, but we may use photographs or your data on rare instances for publications or studies. I'll review that with you if so. There will be an opportunity while we talk to ask questions. We want all of them to be answered. If anything comes to mind, feel free to ask me or the nurses. Otherwise, we'll get your signature and get underway.